Now finally we will be doing sexually transmitted diseases. It is bacterial vaginosis, Trichomonas vaginalis and Candida vaginitis. Bacterial vaginosis, the causative organism is altered vaginal flora. Basically, the vaginal flora, which is normally pleasant, is altered, and there is increased concentration of Gardnerella vaginalis. In Trichomonas vaginalis, Candida vaginitis, Candida albicans. Etiology: why there is this altered vaginal flora? Why? Because there is increased pH. Because vaginal pH is less, it is acidic pH. So if it becomes alkaline, then the vaginal flora is altered and the Gardnerella vaginalis increases. Increased vaginal pH. Trichomonas is sexually transmitted, right? And Candida occurs in decreased immunity. Sexual transmitter, yes. Sexually transmitted is only of Trichomonas vaginalis. Others are not sexually transmitted diseases. Then pH here, obviously alkaline pH. Here is also alkaline pH, sexually transmitted alkaline pH. And in Candida, it is normal acidic pH, normal pH, acidic pH. No vaginal epithelium inflammation in speculum no speculum examination. In bacterial vaginosis, there is no vaginal inflammation. In Trichomonas, there is strawberry cervix. In Candida, there is inflammation. There is no vaginal inflammation, strawberry and inflammation. In KOH, here there is positive whiff test. It can be positive, and here in KH mount pseudohyphae are seen. Wet mount, clue cells are seen, but no WBC because inflammation is absent. So no WBC. Here there is motile trichomonads and WBCs are seen. Here also WBCs are seen, because it is strawberry cervix inflamed. In this both inflamed cervix, so WBCs are seen. For bacterial vaginosis, we give metronidazole and Clinda. Here we give metro, and here we give oral or vaginal azoles. No need to treat partners. Only in Trichomonas vaginalis we treat the partner also. So partner management when asymptomatic is not required for Gardnerella, bacterial vaginosis, Candida, and herpes infection. This is important. Herpes infection is important. So in this and this, no partner treatment. Here partner treatment is required. Now we have STI color coded kits, as we have seen all the sexually transmitted diseases, right? And also we know that in bacterial vaginosis we give metronidazole and clindamycin or clindamycin. In Trichomonas also we give metronidazole and treat partner also. In Candida we give azoles, topical or vaginal azoles. Oral azoles. Candida we give oral azoles and vaginal azoles. Then we have kits. We have grey kit, green kit, white kit, blue kit, red kit, yellow kit, black kit, and brown kit. Right? If there is syndrome, if there is urethral discharge, vaginal discharge for cervicitis, painful scrotal swelling, epididymoarchitis, so it is most probably Neisseria vagera, Neisseria gonorrhea and all. And presumptive treatment, we give tablet azithromycin, tablet cefixime. Here vaginal discharge symptoms for vaginitis, vaginitis, we give sacnidazole and fluconazole. It is syndromic management. Just think about syndromes. Grey kit for urethral discharge, vaginal discharge, scrotal swelling, presumptive treatment. For vaginal discharge, if there is cervicitis, then it is grey kit. If it is vaginitis, then it is green kit. This is very important. If it is vaginitis, then green. If it is cervicitis, then grey. And urethral discharge, vaginal discharge, painful scrotal swelling, presumptive treatment. Then we have vaginal discharge for vaginitis, green kit. Then we have genital ulcer disease syndrome for syphilis and chancroid. Then we have genital, in this we give white kit. And then we have for syphilis and chancroid when unavailability or history of allergy to benzene penicillin G. Then we give blue kit. Genital ulcer syndrome disease for herpetic ulcer, genetic ulcer for syphilis and chancroid, for herpetic. Then we have lower abdominal pain or PID. Then we have inguinal bubo under genital ulcer disease syndrome, or LGV proctitis under anorectal discharge syndrome. Then we have anorectal discharge syndrome, राइट. सो अभी तक हमने क्या पढ़ा? किट्स कौन सी हमारे पास? वी कैन हैव ग्रे किट, ग्रीन किट, देन वी हैड वाइट किट, देन वी हैड ब्लू किट, देन वी हैड रेड येलो, then we had black kit, and finally we had brown kit. GGW BRYBB. We have gray kit, green kit, white kit, blue kit, red kit, yellow, black and brown. Gray, green, white, blue, gray, green, white, GGW, BRY and BB. Go girl while blue while bro can be remembered as bro because it has yellow, red, blue. Go is gray, green is girl, and white is white, while is white, and BB is black, brown. Go girl, great girl with bro, great girl with bro, ब्लैक एंड ब्राउन. मतलब एक ग्रेट गर्ल थी, वो अपने भाइयों के साथ थी, उनमें से एक भाई ब्लैक था, एक भाई ब्राउन था. ठीक है. तो ग्रे किट हम देते हैं यूरेथ्राइटिस, वजाइनल डिस्चार्ज सिंड्रोम, वजाइनल discharge syndrome but of cervicitis. Then we have scrotal pain, swelling, scrotal pain for girl, which is green kit. We have vaginal discharge syndrome but vaginitis, Then we have genital ulcer, syphilis and chancroid वाले, blue genital ulcer, syphilis and chancroid वाले which are allergic to benign penicillin G, red is for HSV वाले herpetic ulcers. Then yellow मतलब पोटी के टाइम हमें क्या आता है? लोअर एब्डोमिनल पेन एंड पेल्विक इन्फ्लेमेटरी डिजीज़, PID, पद और लोअर एब्डोमिनल पेन. देन ब्लैक हमें पता ही है ब्लैक का किसके लिए होता है? इंग्वाइनल बूबोस अंडर जेनाइटल अल्सर डिजीज सिंड्रोम, इंग्वाइनल बूबोस एंड LGV प्रोक्टाइटिस. ब्लैक LGV प्रोक्टाइटिस. ब्राउन में क्या आता है? अब सीधा ही ब्राउन पट्टी किस में से आएगी? एनोरेक्टल डिस्चार्ज सिंड्रोम. ठीक है. एक बार फिर रिवाइज कर लेते हैं, सादा ही इसको कैंसिल कर देते हैं अगर हम, और फिर एक बार रिवाइज करते हैं. ग्रेट गर्ल विद ब्रो, B black brown, gray kit, green kit, white kit, blue kit, red, yellow, black, brown. It is for gray kit is for urethritis, vaginal discharge syndrome but of cervicitis, urethritis, vaginal discharge syndrome of cervicitis. Then we have scrotal swelling with pain, and then we have presumptive treatment, right? Then green is for vaginal discharge syndrome but of vaginitis. White is for genital ulcer syndrome with syphilis and chancroid, but resistance or allergy to penicillin G, or even if it is unavailable, the white kit is unavailable, then we can give green kit. Red kit is for genital ulcer syndrome but herpetic. Yellow is for lower abdominal pain and pelvic inflammatory disease. Black is for inguinal bubo under genital ulcer syndrome and proctitis of LGV. This is important to remember, proctitis of LGV. Brown anorectal discharge syndrome. Right? Now we have to remember the drugs. पहले तो इसकी ड्रग्स याद करनी है हमने बेसिकली इसकी.